our center is fully into academics and of course excellence, and under the ARD, under the leadership of our president, Dr. Erebo, thought it wise to bring this to us as part of our OGM. This is to fully equip us with the knowledge on research, and of course the mandatory dissertation writing, which is necessary for our progress in our respective colleges, and also as addition to the body of knowledge in medicine. So at the end of the lecture, we should feel free to make comments and ask questions, contributions. This we can also do by dropping messages on the chat box. Our speaker this evening is a well-respected teacher, an academician, a general surgeon per excellence in the Department of Surgery, FMC Abuja. He has contributed a lot to training residents and has a lot of work both in soft and hard copies, of which some of us or most of us know about. So we are very confident that, as usual, he will dissect and demystify this topic. So I want us at this point to welcome our speaker, our chief, Dr. Bashiru Yunusa. Welcome, sir.
Thank you very much, Dr. Awuzie, and good evening, everyone. Thank you for having me at this your ARD program. It's a pleasure, and it's very important topic which is to be discussed. As Dr. Awuzie introduced, this topic is important. One, to residents who are preparing for proposal writing, and also important regarding the full length of their dissertation paper. This is very important. And also it will motivate us for research. So at the end of this presentation, the objectives, one is for each and every participant to be able to come up with a proposal writing, as well as if you have already gotten approval for a proposal, you should be able to write your full length manuscript, and it will also open your mind towards research so that you can be able to propose a hypothesis and how to come up with a research from a proposed hypothesis. So this is the aim of this presentation. And today we are going to be using this outline in defining what research methodology is all about, the objectives of research, types of research, then study design, then levels of evidence with regards research, then research process flow charts. Because if you are to make a research, you should know, or you should have a blueprint or a roadmap so that you will be properly guided. Okay, then hypothesis testing. How do you test a hypothesis? When you propose an assumption and you want to put it to a test, how do you go about it so that you make up a research? Then writing the full length paper, then a proposal for dissertation, then some few recommendations, and that will be the end of the presentation. Now, by way of introduction, when we say research methodology is the strategic framework. It's a framework that outlines the systematic process researchers use to collect, interpret and analyze data. Okay, you need a framework, you need a blueprint, you need a roadmap, because it is a scientific process. It's a systematic process. Collection of your data, interpreting your data, and analyzing your data requires a methodology. And that is what we call a research methodology. It acts as a roadmap, providing a structured pathway for investigators to follow, ensuring reliability, validity of their findings. There should be no confusion. If you make a research in a particular center, that research should be reliable, valid, and should be able to be reproduced elsewhere without any confusion or controversy. In essence, research methodology is the blueprints that govern the entire research journey. What are the objectives of research? The purpose of research is to discover answers to questions. Whenever you come up with a research, there is a research question you want to answer. Now, the purpose of research is to discover answers to those questions through the application of scientific procedures. Some of the objectives are to gain familiarity with a phenomenon or to achieve new insights to it, to portray accurately the characteristics of a particular individual, situation, or group, to determine the frequency with which something occurs or with which it is associated with something else. Research will help you determine frequency as well as associations between variables to test a hypothesis of causal relationship between variables. So these are some of the objectives of research, but in a nutshell, you should know a research is proposed to discover answers to questions which may come up as an assumption, which may come up as a hypothesis. You want to test how correct that hypothesis is. Now, what are the types of research? The main three categories of research methodology are qualitative research, quantitative research, and mixed method. The qualitative research is a non-numerical data-based research. It employs a non-numerical data such as interviews, observations, okay, an open-ended survey to explore the complexity of human behaviors, attitude, and experiences. You can see for qualitative research, you are actually studying behaviors and attitude and experiences. It is a non-numerical pattern. The data you obtain are non-numerical. This method is ideal for uncovering nuanced insight that quantitative methods might overlook. So basically in medicine, we do not commonly employ this research type. In sociology, psychology, anthropology, these are commonly used there. But quantitative research is concerned with the collection and analysis of numerical data. It employed structured survey, experiments, and statistical analysis to identify patterns, relationships between variables, trends within a large data set. Okay, it provides a more objective and measurable approach to research. So this is a more objective approach to research. So this is the one that is commonly employed in the field of medicine. Okay. Now, why is this more important? Because it draws statistically significant conclusion, because any result you achieve as an outcome of your research, okay, you subject that to a statistical test to see if it is statistically significant or not. And it is with quantitative research you will achieve that. And what you derive from the sample can be generalized usually to a broader population. While the mixed method is a hybrid where you use both types of research in combination. Okay. Now, what are the types of study design? Now, broadly, epidemiological study design, okay, epidemiological study design for all studies can be grouped into experimental and observational. It can be grouped into experimental or observational. This is self-explanatory. Now, the experimental types could either be randomized controlled trials. Randomized controlled trials are the gold standard for research, okay? Then you have community trials. The other arm is the observational research method, which could either be descriptive or analytic. The descriptive could either be surveys, cross-sectional surveys, or qualitative. Then the other branch of the observational is cross-sectional, case control, and cohort study. Now, broadly speaking, we have descriptive study and analytic study. The aim of a descriptive study is to study the distribution in a population, time, place, person. While for analytic study, it studies risk factor, okay, etiology. We'll explain further for better understanding. Now, this scheme is showing the branches of research with specific examples. When you say descriptive research, the examples you have in a descriptive research are case reports. If you have similar case report of the same feature, they form case series, descriptive surveys. Then the analytic, which also could be experimental or interventional, or the observational, which is when you hear a cross-sectional, case control, cohort study, they are all analytic research type. I'm going to explain further in due course so that when you are describing your study design in your proposal or your dissertation, you will appropriately mention what type of study design you have, okay? So this is still portraying the same message, but for cohorts, you know, it could either be prospective or retrospective, okay? So we'll further see this in detail, okay? So study design can be classified broadly into descriptive or analytic, which are inferential or observational, okay? Even though they could be experimental. Both of these are observational, okay? So now this table okay, sorry, I have a little breaking network there. So this table categorizes descriptives. It tries to differentiate descriptive from analytic, Okay, it tried to differentiate descriptive from analytic. So the descriptive, what are the questions asked in a descriptive survey or descriptive study design? What are the questions asked? When was the population affected? For analytic, you will be asking, how was the population affected? Okay. For descriptive, you will be asking, where was the population affected? And analytic, you are asking, why was the population affected? Okay. Then, who was affected for descriptive? If you remember the questions we said they focused on. Now, study the descriptive. This is still the same thing. We say a descriptive study describes the characteristics of interest in a study population. These studies do not have a comparison group. Do not have a comparison group. Maybe you are just studying a particular case, just a case report. You are not comparing that case with any other thing. The simplest type of descriptive study is the case report. In a case report, the researcher describes, experience with symptoms, signs, diagnosis, or treatment of a patient. Sometimes a group of patients having similar experience may be grouped to form a case series. So a case report is a classical description of a descriptive study design. Analytic or inferential study try to prove a hypothesis and establish an association between the exposure, which is the risk factor, and an outcome, which is the disease. Okay, you might have an exposure that leads to an outcome. An exposure is the risk factor. The outcome will be the disease. These studies usually have a comparator groups. You are comparing with other groups, unlike a descriptive that could just be a case study. Now, analytic studies are further classified as observational or interventional or experimental. We saw this on that chart, which was initially projected. In observational study, the researcher merely observe outcomes in different groups of participants who, for natural reason, have or have not been exposed to a particular risk factor. Example of observational study: the cross-sectional study, case control study, and cohort study. These are observational analytic studies. Okay, so when you are describing a study, maybe to break it down, you say it is observational and it is analytic study design. Okay, based on what you are doing. Okay, it depends on your research. So you can even add maybe is a prospective, observational, analytic. So you follow pattern that will make sense when describing your research work. Okay, now, what is a cross-sectional study? Just a cross-section, a snapshot of a group of population at a particular time. As the name implies, you are taking a snapshot of a group of population at a particular time. You are interested in some specific features or some specific groups. In cross-sectional studies, data are collected from the study population at a single point in time. You just have a snapshot of a group of population and you pick specific features you are looking for. Now, exposure and outcome are determined simultaneously. okay, prevalence of health conditions, and possible association between risk factors and outcome can be determined. For example, you have a patient presenting with, you want to assess, let's say, obesity and breast cancer, for example. So you have women as the group of population you want to pick for this, that are between 45 to 60 years, for example. Okay. So when this group of population comes to your clinic, you just look at a snapshot of the group of women, okay, within this age group. And at the same point, you are assessing an exposure and outcome in those particular group of patients. It doesn't require follow-up. But because of the nature of maybe your research, you will not see a large group of people, up to 100, presenting to your clinic at a particular time. You will do a consecutive study of such group of patients. But what are you looking at? You are looking at exposure and outcome at the same time, simultaneously, to see if this category of people have it. So if they have, you document. If there's no association, that is all. They are not coming for follow-up. But here, the cross-sectional study has two main limitations. The first one, may not be possible to establish a clear cost-benefit relationship. You don't know if the obesity was there before the breast cancer, or the breast cancer was there before the obesity. For example, in a study of association between colon cancer and dietary fiber intake, it may be difficult to establish whether the low fiber intake preceded the symptoms of colon cancer, or whether the symptoms of colon cancer resulted in a change in dietary fiber intake. Okay. So another limitation is survival bias. For example, in a study looking at alcohol intake versus mortality due to chronic liver disease, among the participants with highest alcohol intake, several may have died of liver disease. This will not be picked up by the study and will give biased result. At the time of your study, maybe the most affected have already been, even they are already dead. The ones that are not even taking more survived at the presentation of the study. So look at this group. You are looking at a cross-section of population now. You want to select member of certain population subset. If you look at this population subset, you might decide to take the elderly group, okay? You want to study relationship between maybe prostate cancer and maybe fat intake, okay? You might want to take the population of Blacks that are within young age group. You might want to take, so in a cross-section of a population, you study exposure and outcome at the same time, taking a snapshot of a population. That is a cross-sectional study. While in a case control study, okay, in a case control study, it's always a retrospective study. That is, the outcome of interest has occurred when the study is designed. The researcher identified exposed individuals, which are the cases, and non-exposed, which are controlled. Okay, then matching is done based on factors that are likely to influence the exposure or the outcome. For example, you take certain characteristics in this population, maybe age group, gender, socioeconomic class of maybe you say 20-year-old, okay, males that are exposed and 20-year-old males that are not exposed. Then you now study the outcome of a particular disease, maybe smokers and non-smokers, and you want to study lung cancer. Okay, you see, but you have to take a specific feature that is common between the case control. Is it age? Is it gender? Is it socioeconomic? Then you have a group that are the exposed and the group that are the control, non-exposed. Then you now study the presence of an outcome in these groups of individuals. Okay? So exposure is the risk factor, while the outcome is the disease. It's studied in case and control parts. Now, the limitation. What is the limitation of case control? Now, the first limitation is matching case with control may not be easy, since many unknown confounders may affect exposure and outcome because of presence of co-founders. It may affect the exposure and outcome. Second, there may be bias. Okay, there may be bias in the way the history of the exposed is determined versus in case versus control. Okay, so this is clear. Subject identified as having a disease or a condition are compared with subject without the same disease or condition. So it could be exposure or a disease. Now, a cohort study is even more, it has a higher level of evidence compared to the previous ones that were discussed. The researcher here begins with a group of individuals who are free of outcome at baseline. Okay, they don't have the disease. They are a group of population which forms your baseline. Of these, some of them may have been exposed to a particular risk factor. Maybe you are taking all the resident doctors, okay, at the beginning of your study. Then you now said, okay, residents that are involved in cigarette smoking, okay, compared to residents that are not exposed to cigarette smoking. Then you want to study them for over time to see who amongst them will develop lung cancer. So your group of population are the group of resident doctors. Those that are exposed now are the cohorts. Those that are not exposed are the control. They will be studied for a longer period of time. The group are followed up over a period of time to determine occurrence of an outcome. Cohort study may be a prospective involving a period of follow-up after the start of the study, or retrospective using the record. Okay, this one is considered the strongest among the observational study design. They provide proof of exposure occurred before outcome. Okay, allow determination of risk and permit multiple outcome to be studied for a single exposure. Okay, now you see cohort, the subjects are categorized on the basis of their exposure to one or more risk factors, and they are studied over time. Now we are going to quickly look at the level of evidence as a hierarchy in the hierarchy of research. Now, systemic reviews and meta-analysis are regarded as level 1. They have the highest level of evidence in research works. Systemic reviews and meta-analysis are regarded as level 1. They have the highest level of evidence. This is followed by randomized controlled trials. Okay, this is regarded as level 2. Then cohort, you can see we just talked about cohort, is having a higher level than the other groups. Then case control, case series or case report. Then you have expert opinion. okay, which is around the level 6. Now, you will see different levels of evidence based on the reference material you are using. Some have even categorized the level of evidence up to 9, but some are up to 5. But what you should know, the highest, which is level 1, is the systemic review and meta-analysis, while the lowest is your expert opinion. Expert opinion alone is not enough as a strong level of evidence, okay? So now, if you look at this, it's also giving the level of evidence hierarchy from level 1 to 5, where the systemic review of high quality randomized controlled trials and meta-analysis are at level 1, while the lowest at level 5 is the expert opinion. And don't forget, we said the gold standard for a research work is randomized control trial. We won't go into the details of this, but you will have the recordings of all these discussion as well as the slides, so that you can go through them. And also, if you have any questions or clarification regarding this, we'll discuss after the presentation. Okay, now let's look at a research flow chart. Now, you don't just embark on research anyhow. You must have an outline, a guide, a process, or a flow chart that guides you when conducting a research. Now, you define a research problem. Without a problem, you can't embark in any research, because the entire purpose of a research, as we mentioned at the beginning, is to answer questions of some problems that are raised, okay? Now, when you define a research problem, okay, you have to develop a research questions, okay? There's an existing problem. You now raise a research questions that you want to answer at the end of that research, okay? Then you have to conduct a literature review and see what other people have done on that particular problem, okay, and how they've answered the question, and what are the gaps they've left unanswered, okay, regarding the question or that problem. If you've gone through the literature review, then you now formulate a research hypothesis, okay? This research hypothesis, which we'll talk on shortly, you have to prove whether that your hypothesis or assumption is right or wrong. Then you now select the appropriate research design. Because if you don't select an appropriate design, you might get it all wrong. Before you now start collecting data, you analyze your data, interpret your data, draw conclusion from your data, then you now communicate your findings. Okay, so that is just a brief flow chart on how to conduct a research. Now, this is a very important aspect in any form of research you are doing, hypothesis testing. Hypothesis is an assumption, okay? Proposal to explain observations or facts that requires further investigation to be verified, okay? Now, sample is taken from a population, okay? You cannot study the entire population. You take sample, and it is from the sample you study, you are going to draw conclusion for the entire population. So that is why you have to be very systematic, you have to be very objective, and you have to completely eliminate bias. because you are sampling a population, because your resources and time will not be enough to study the entire population, okay? A hypothesis should be short, precise, specific, and capable of verification. Now, in testing hypotheses, there are 8 steps you have to pass through. There are 8 steps in hypothesis testing, which we will briefly see what those steps are. If you formulate a hypothesis, you ought to subject that hypothesis to testing or a research to draw out a conclusion, to generalize that conclusion on a population. You must undergo these 8 steps. Number 1 is to state the null hypothesis. When you say null hypothesis, is the hypothesis of no difference. There is no difference between two. You make an assumption that there is no difference between two variables or factors or assumptions you want to study. Now, the aim of an entire research is to discard your null hypothesis at the end of your research, is to discard your null hypothesis at the end of your research, okay? So, for example, there is no statistically significant difference between the mean height of the population of male and female resident doctors. You want to study the mean height of resident doctors. Resident doctors are either male or female. So you want to state a hypothesis of no difference. The hypothesis of no difference is saying the mean height of male residents is equal to the mean height of female residents. That is your initial assumption. At the end, you want to prove, okay, this point. But your aim is to discard the null hypothesis and accept the other type of hypothesis, which is the alternative or the alternate hypothesis. So your first step in hypothesis testing is to state a null hypothesis, which is a hypothesis of no difference. One value in the mean is equivalent or equal to the other value. Now, the second step is to state the alternate hypothesis. This is the opposite of the null hypothesis. For example, using the above example, there is statistically significant difference. Now, this word is very important. You cannot just say there is no difference. No, statistically significant difference in the mean height of the population of males and female resident doctors. Okay, now the next step is to state your alpha value of significance. By international convention, the alpha level or value of significance is at 5%, p-value of 0.05. Okay, so if the calculated test value fall in the rejection zone, okay, because you assume your data is a normally distributed data. After stating your alpha value, you calculate that. Maybe we'll have another session subsequently, not in this, to see how to calculate all these things. Now, here, this zone is called the rejection zone. Any value that falls within this zone after your analysis, okay, of your research work, okay, it falls in the rejection zone, the null hypothesis will be rejected and the alternate hypothesis will be accepted. Now, for example, after the end, depending on the test you use, and you got a value of 0.02, okay, you can see it is less than 0.05. So it means your null hypothesis will be rejected. That null hypothesis, you mentioned that there is no statistically significant difference between these two groups, will be rejected, and you will accept the alternative hypothesis, because you have proved that at the end of your research work. Now, the fourth step in your hypothesis testing is to choose the appropriate test statistic. Now, ladies and gentlemen, if you miss this step, you have missed the entire research work. This step is one of the most important steps in whatsoever research you are doing, whether you're manuscript writing for your dissertation or whatsoever. If you miss this test, you have missed everything, because you have to choose the appropriate test you are using. Sometimes in your proposal, you are proposing that you want to use a certain test, maybe chi-square or whatsoever you want to use. Then at the end, when you now start your real dissertation work, you now find out that that test you propose is not applicable. So you have to choose the appropriate test statistic. This is important to get the right outcome. For example, the test statistic, maybe you are using your z-test, the t-test, the chi-square, or the Fisher test. You must understand all the criteria that are required for you to choose a particular test at the for your analysis, okay, for your work. Now, when do you use the Z, T, or the Fisher test? They are used for quantitative variables. The chi-square is used for qualitative variables. The Z and T tests are used when the mean is in one or two groups. The Fisher test is used when comparing mean of more than three groups, because if it's just one or two, you use the T or the Z test. But you use the Fisher test where you are comparing mean of up to three groups. This will make more sense to you later when you have gone far, but the material will be there and you can come back. If the population standard deviation is known, if the standard deviation of the population under study is known, you must use the z-test, regardless of the sample size. So any sample population where the standard deviation is known, you use the z-test, okay? If the sample size is greater than 30, if your sample size is greater than 30, now, okay, you use the okay. If the sample size is less than 30, you use the okay.
What you're teaching you people.
We have some disturbance at the background.
I went to the
Did you tell them anything?
Of course, I told them what's going on, but I didn't tell them it was.
Okay.
Okay. Are you serious?
Doctor, you will kindly mute yourself.
Okay, if the sample size is less than 30, you use the t-test, okay? Okay. The next step we are going to is to draw the distribution curve of the chosen test statistic. Now, after you have chosen maybe the z-test, you want to use a z-test, you draw your distribution curve, whether it's a, depending on what you want to do, but later with time you come to, and you indicate your rejection zone based on what you have calculated, okay, using your formula. The formula will tell you where your rejection zone is. And whatsoever you get as your rejection zone, it is indicated. Now, your final value of the research will tell you whether you will accept the null hypothesis or you will reject the null hypothesis based on this distribution curve you have drawn and based on the rejection zone you have indicated. Now you calculate the value of the test statistic using appropriate formula. We won't go into this. These are entire presentation on their own. So you make your decision. If calculated values value falls in the rejection or critical zone, reject the null hypothesis and accept the alternate hypothesis. Then you obtain your p-value. Okay, so now we'll go into a full-length research paper. When you are writing your research or your dissertation, there are guidelines you follow. A full-length paper is a manuscript with clear-cut outline, the IMRAD pattern. This mnemonic, the IMRAD. Okay, now the IMRAD is preceded. It's the introduction, methodology, results, analysis, and discussion. This is the pattern of a full-length research paper. The IMRAD is preceded by a title page, the conflict of interest, and abstract. It is followed by the references and acknowledgement. Now, you should know that this pattern may vary based on the journal intended for publication or the guideline of the intended examining body. For example, your West African College of Surgeons, your National Postgraduate Medical College will give you their guidelines. So you may find some variations from what we are going to present, but basically we are taking what is in conformity with your dissertation writing approved by the West African College of Surgeons commonly. So you might see some attestation page coming, ethical approval, etc. All those will be in the guideline on where you are submitting your research. Let's start with the title page. The title page has the title of the paper, the title of your research, the name of the author or the authors, the address of the author, phone number, and email, the address of the institution of the work is carried out, if there's any grant support, the months and the year of the publication. The title should be concise and truly reflect the substance of the paper. Now, your title will be captivating. It will either encourage readers, whether this is an interesting work or not. It should be less than 45 characters or less than 20 words, okay? Including the spaces in between the words. Now, if you are writing a title, it should be concise. Don't be writing an AC as a title. It shouldn't be more than 45 characters. It should be less than 20 words. Remember, the name of the institution is not regarded as the number of words. For example, the title of your research in Federal Medical Center, Jabi, Abuja. Federal Medical Center, Jabi, Abuja is not counted in part of the number of words. So you should use words that captures attention, okay? The word forward as, okay, it should be the first word you use in the title or at most the second, okay, to capture the attention of the reader. Now, the types of title, there are three main types of title. You have a declarative title, okay? A declarative title is not commonly used in your work. Why? You will see, because it states the main finding of the study, okay, in the title itself. It reduces the curiosity of the reader, okay, may point towards a bias on the part of the author, and this should be best avoided. For example, teenage abortion causes infertility. You see, you are already giving the final result of your work in the title, okay? You are already giving the final result of your work in the title, okay? So non-declarative title, okay, they raise issues that need to be confirmed or otherwise through careful study. You raise a title, it is your research work that will confirm the result at the end of your research. For example, infertility in patients with history of abortion in teenage years. You are not saying that this abortion is causing infertility. You just mentioned that what is infertility in patients who have history of abortion in their teenage years. You are not declaring the outcome in your title, and this is preferred in our dissertation writing. You have an interrogative title, which frame the title in form of a question. This can create interest by making the reader, okay, immediately wonder what the answer might be. It's also a concise way of presenting a research topic. So these are the three basic types of title. Now, the next thing we look at is the abstract. Your abstract should be written in past tense. We are talking about a full-length dissertation paper, not proposal. You are writing in future tense. Now, write in past tense, and it should not be more than 250 words. This abstract could either be structured or unstructured, okay? There should be no indentation or paragraphing. Your paragraphing shouldn't have indentation when you are making an abstract, okay? So no sentences should start with a figure or number, okay? Such number should be put in words at the beginning of sentence. Abstract, no referencing should be cited in abstract. All statements must be derived from the work done and reported in the manuscript. Don't be stating things that are not in your research so that you think it will make your research richer. No. Okay. Now, the abstract should follow the IMRAD pattern. Results should be concise and percentages should be rounded up. If you have 69.8 in the abstract, you should round it up as 70%. Okay, don't be leaving figures that are not rounded up. Now, the statistical test and level of significance should be mentioned in your abstracts that you are using so test statistics which set at a level of significance of 0.05. You should mention that. The keywords should not be more than 10, should be 3 to 10 between that and separated by comma. Okay, the first letter of the keyword should be in capital. Okay, what does the keyword serve to do? The keyword serve as a search engine to locate your paper. Whenever your paper is being searched for on the internet, it is that keyword that serves as the search engine to locate your paper. Now, your abstract must answer the following question to be a complete and comprehensive abstract. Why should I bother to read this paper? It should be in your title. Why did you do it? The introduction and the objective of your abstract must carry why you did that. How did you do it? Your methods. Okay? What did you find? Your results. And what does your result mean? What does it mean? What should I do now in your conclusion? Okay? Now, the next aspect we'll talk about is the introduction. It brings up the full problem. Okay? It brings up the problem in full perspective, the problem you are studying. Now, significance of the study by providing a good background of the disease or other object of interest. So you are going to give a good background of what you are studying, okay? Now, this will give significance to your study. Now, of course, the introduction is referenced, should be between 5 to 15 references, okay? You have to cite references to the information you are providing in the introduction. And it should be an engaging introduction that address problems, Okay, it shows the significance of that problem you are studying. What is the morbidity of that your problem? What is the mortality rate? That will show the significance of why you are studying it. Okay, it will show the epidemiological significance. What is the knowledge? What is the new knowledge you are adding? What new are you adding to the body of knowledge? Okay, you have to give a background literature on that disease condition or whatsoever you are studying. Okay, its hypothesis must be clear and concise. Your hypothesis must be clear and concise. You have to give the justification of your study and also the scope of the study, all the general area to be studied, because you cannot, if you are taking, for example, breast cancer, it's not everything. You have to streamline your discussion. If you are studying prostate cancer, if you are studying gastric CA, whatsoever, measles, you have to streamline, okay? What is the scope? You can't study everything because the scope of that particular condition might be too wide for your study. So it has to be very clear. Now, the methodology. Your methodology describes the method of study in a clear and simple terms. It must be reproducible by another scientist elsewhere. Don't do things that only you know what you are doing. Only you can report. That is useless. If you do a research and a methodology that cannot be explained, that cannot be reproduced elsewhere, that is unscientific, okay? Because it's only traditional practitioners that will do such a thing, that they will do things that you cannot reproduce. But scientific publications must be reproducible by a researcher elsewhere, okay? So any modification of an established procedure must be stated clearly and referenced properly if it has been used before. If you are describing a procedure, you have to describe it clearly, okay, step by step, the way the procedure is done from beginning to end. And if your research includes a modification of that particular procedure, you should state that clearly and reference that modification where you picked it from, if you are not the first person who is modifying that procedure. So you have to reference it. Manufacturer names and models of the tools you use or the reagents should be mentioned. The essence of all these things is because of that reproducibility, so that someone else can do and get a similar outcome. Inclusion and exclusion criteria should be clearly stated, okay? Studies that involve humans or animal subjects must conform to the Helsinki Declaration of 1975 to protect the human rights, health, and not to do harm on patients. Drug trials use must be a registered drug. Don't go and get an unlabeled drug that is off market. Only you know where you got your drug from, and you now start subjecting that to a trial. It might harm your patient because it has not undergone scrutiny and review by a registered body that tends to review all these things. Now, statistical methods that are used and the software you use must be mentioned. Now, this is the building block of a research methodology. When you are presenting, you must state your study population. Your study design must be clearly stated. The duration of your study, the inclusion criteria, the exclusion criteria, the sample size estimation, your detailed methodology of the procedure you are describing, then the statistical analysis and of the outcome must also be clearly stated. This involves from the point of your data collection, how you collected the data, how you impute your data, what software you use, how you analyze, and how you got your results. Now, this will bring us to the result. The result should be presented in a logical sequence. Don't be haphazard. Okay, it should always reflect the aims of your study. Let me tell you, when an examiner is reviewing your proposal, is reviewing your dissertation, he will look at your results. Is it conforming with the aim of the study? He will look at your conclusion. Is this conclusion conforming with the objective you earlier stated? If it is not, you are going to redo that work, because that is not what you told them. You told them something else and you are presenting something else. The discussion and conclusion is also based on the result. You can't be discussing someone else's results you read from your reference material and you start introducing that into your own work. That is unacceptable. Whatsoever you present must be what you did from your own work and the result you derive from your own work. This is written in past tense. The result should be in form of text, table, illustrative figures, numerical values, and percentages are reported. When you write a numerical value, maybe 9, this accounts for maybe 20% in brackets. You understand? So, tables and figures should not be repeated in the text. You are already giving a table and you are repeating it in a text, but serve as a reference only. Okay, reference should not be cited in your result. This is your work. Why are you referencing someone else's work that was done a year ago? Why are you? It is your own work, so it should not be referenced. Do not explain or justify any figure. The portion, this section of the research is just to present a result the way you got the result. Okay? The section for discussion will take care of justifying any table or any figure you got. The table are numbered serially in Arabic numerals. For example, table 1, table 2. Okay? Don't just scatter table. And in your discussion, you said the first table I mentioned in page 24, the second table that followed the first table into, you are confusing, they will just close your book. Nobody will read such a confusion. So you have to label your table properly. It should have short titles, not sentences. You shouldn't be writing a long sentence, a compound sentence, a very complex sentence that is even more than the information that is in that table. So because it's not a sentence, it shouldn't have a full stop, just concise title, okay? Many journals discourage tables that have vertical lines, okay? Because it makes it overcrowded. Just horizontal lines are standard tables that are not more than 3. Avoid symbols or abbreviation except if they will be explained. Now, this is a typical example of how a table should be. You should see it's not more than 3 lines, okay? There are no vertical lines, okay? And you can see the title is very concise. It is labeled table 6. There is no full stop at the end. You see the numbers, proportion in percentages, and it is clear, simple, straightforward, and self-explanatory. This is how a table should be presented in a research work. Now, let's quickly go to the discussion. Now, the discussion is based purely on the results of the study. The main findings should be discussed first, followed by its significance. What are the significance of your main findings in the research work and the implication of your main findings? The strengths and weaknesses of the study design should be discussed. The study design you use, why do you use it? What is the strength? What are the lapses? The results should be compared with similar previous study in literature. It should be similar. Your results should be similar to what what the discussion should be on similar work. Don't be discussing something that is completely different from your research work. Okay, that is not acceptable. Okay, so now the meaning of study implication to clinicians and scientists, you have to mention the meaning. Okay. Also, sorry, the methodology should be discussed, because the reason why all these things have to be discussed, it will tell you why your own result is different from somebody doing the same study elsewhere. Because of the variation in study design, maybe some variation in your methodology, this must be clearly stated. Because when you are discussing other results, you must be saying why yours is similar to a particular study that is the same as yours, and why the variation. And the reason why you have this variation is because of differences in methodology, modification in methodology, characteristic of the population in that particular area. These are the things you have to point out so that your examiner know that, okay, this guy knows what he's doing. The meaning of your study, the implication of your study to clinicians, to scientists, to policymakers, to the patients. Its addition to the body of knowledge, even the limitation should be discussed. You don't want to do a research that is meaningless. You are not adding anything to the body of knowledge after the research, and they ask you, and so what? We know it. What are you trying to tell us? You understand? So you should have a research that is meaningful. Okay? Now, ordinarily, not to exceed 4 pages if you are writing a manuscript for your dissertation with double spacing, okay, except if you have so much and much you want to discuss, should be in past tense. Now, the building block of a sound discussion section are the main findings. Don't forget, the main findings from your result must be discussed, okay? Then 2, the strengths and weaknesses of your study design, the significance and implications of your findings. These are the things you are discussing. Citations of relevant references. Relevant references, they must be similar to your work. And you must mention similarities and difference from your work. Why the similarities and why the differences? What are your limitations, okay? And the conclusion. Now, the conclusion must have a direct, it must have a direct relationship with the aims and objective of the paper. Sometimes if you go for an oral exams, the examiner don't have time, they will just be comparing things. What are your objectives conforming with the conclusion? Is the result conforming with what you even said you want to do? And all that. And could be drawn only from the results of your study. Don't make a research and be concluding your colleagues' research. Okay, so your references, your referencing or the citing of literature used in the text relates only to the core issues of your work done. Okay, don't, because of course I'll be using breast cancer commonly because that is my area. You are using breast cancer research. Maybe you are working on triple negative breast cancer. Most of the papers you should be citing should work on triple negative breast cancer. Not that you go and be talking about something that has to do with sociology, the social impact of breast cancer on female population. You see, in fact, you don't know what you are doing if you are citing references like this. So whatsoever references you are citing must be related to the work you are doing, okay? the list of references greater, or you see some researchers, the references they will cite will be bigger than their literature review. And surprisingly, they have not read even the complete paper, one of those papers from the beginning to the end. So the point I'm trying to raise here, the list of your references greater or equal to the volume of the written study is not an evidence of quality or scholarship. You might see somebody with just 50 references, 20 references, and he has gone in depth in studying of all those references, and he can defend his research work anywhere because he has read. But you see somebody that his references is bigger than his work, but yet he doesn't have the original copy of one of those references he cited. So that is not actually showing the bulkiness of your references is not synonymous with the scholarship or the quality of your work. It is expected that the author have read all your work cited, okay? Some of your examiner will just go to your reference and start asking questions from, in fact, some of the examiners are the even publishers of, I could remember my part 2 exams because I worked on breast, and my examiner was Professor Anyau. He worked on breast, and the first citation was his work. So we now went to town in discussing, you see, because some of these references might be, the people you are cited might just be there seated. Okay, they are too commonly used, but in our research work, we use the Vancouver system of referencing. Okay, and I think some of these things we cannot really go into them in details now. We might have to get another time to kind of discuss some of these things in detail so that we can really appreciate them in details. Okay, so now we'll talk briefly, and I'll just share the material for you. We cannot go into the proposal writing. The document here can hyperlink, and it will show you some differences when you are writing a proposal for a dissertation. There are different types of proposal. You will see the introduction, the abstract, the background, your justification, your method, and all this, because they are proposal, you see it's in future tense. You are describing most of these things and expected result and so on. This particular page, if you click it, it will download this outline. So I won't go into detail because I've taken more than the time that is allotted for this presentation. So my few recommendation is your proposal as a resident, a senior registrar should be presented, not even ready, presented to the department 6 months of passing your membership of part 1. You should present to your department. At least, even it's not ready for presentation to your department, it should be presented to your unit. Okay, regular updates, okay, on knowledge, on research and statistics is important for every practicing physician. You have to get involved in research with your consultant. In fact, you should be the push, disturb them so that you will be involved in research. And before even graduating, you will have your names in publication. You have to frequent journal review. So the major reference material I used for these is a practical guide for manuscript writing that is produced by the West African College of Surgeons. Then there are some other research methodology textbooks, as well as some websites for research. So thank you very much all for participating in this workshop. And this is recorded. I believe you can use it as your reference material or when you are going through your research work. The slide will also be made available to the ARD so that you can also contact them and get the slides. So thank you very much. It's a pleasure having all of you in this platform. Thank you.
Thank you so much, sir, for this lecture. We are very grateful. I believe I'm speaking for everyone when I say we are very, very grateful for how you were able to simplify this that's for most of us have been bothering us, this particular topic, dissertation writing and all, for how you've been able to simplify it and made it simple for us. We thank you very much. And we are, like I said, very, very grateful. Now we will entertain comments, contributions, and questions. Remember, we can use the chat box to drop questions for our speaker. And also, let's remember to sign the attendance list, drop our names on the attendance list. So we'll just, if you have any question, comment, contribution, you can just raise up your hand, a finger. We'll recognize you and ask, read out the question, or rather, we'll give you the floor to ask your question, make your contributions and comments. So it's time for questions. I believe we have a lot of questions to ask our teacher this evening. And just signify by raising up our hands. Okay. Dr. Anas Eshanoro, you can go ahead, can unmute yourself and go ahead with your question. Thank you.
Thank you, Chief, for the opportunity. Thank you, sir, for the elaborate discussion. So I just wanted to ask about I learned that you said that you can sign tenders. I didn't know how to do this. Thank you. Hello, am I audible?
Yes, can you please come again with the question?
Just wanted to ask about the attendance. You said that you can sign an attendance. I don't know whether it is. Is it in the chat box or?
Okay. Yeah, it's in the chat box. It's in the chat box. Thank you. So more questions.
Thank you so much.
If you have a question, you can raise up your just signify by raising your hand. We'll give you the floor to ask.
Okay, Doctor, I would say I will time to time the ARD organize programs. You know, research methodology like this, it has several aspects that should be dealt with in detail. You understand? Because this is an introduction to research methodology.
Yes, sir.
So time to time, maybe quarterly, you understand, 3 monthly, 2 monthly, monthly, you can organize something that has to do with research, because this is very, very important for residents to go along with the research methodology, because I noticed just once or twice during your training might not be enough. It's very good, it's extensive, the one you do, but it's just a guide. I will recommend that the ARD as a body should fix time. You pull lecturers, give them some various aspects to discuss. Some might talk about methodology alone. Some might talk about sampling. Some might even talk about referencing, testing for hypotheses, analysis, how you use your softwares, your SPSS, and all that. You see, this is something that requires extensive and elaborate lecture over time. Even we are fortunate that when we did the MSc, we have a whole year of studying research and statistics. So that gave us upper hand, not only what we learned from the fellowship. So I think this is something that you should discuss with your members, and it will go a long way in educating the residents properly. Thank you.
Thank you, sir. Thank you, sir, for your suggestion. It's well noted. Thank you very much. There is a question in the chat box by Dr. Alabere. He asked, what is the difference between structured and unstructured abstract?
Okay, that is a very good question. Difference between structured and unstructured. In a structured abstract, you follow the IMRAD pattern, okay? IMRAD, not just a paragraph. In an unstructured abstract, you just write a paragraph. It's just paragraphing, okay? You are not going to give it in headings, introduction, methodology, results. You understand? Structured abstract follows the IMRAD pattern, okay? While on structured abstract, you just present a paragraph, just a flow, just like an essay, but it's not headed like this. Introduction, methodology, result, analysis, and discussion. You understand? But in that paragraph, there should be no indentations, as we mentioned. I hope it's clear.
Yes, sir. Thank you, sir. So we are still waiting for more questions. You can use, like we said earlier, you can use the chat box to drop questions, or you can signify by raising up your hand. Would give you the floor to ask your question.
Okay, it appears that it's either everything is understood or nothing was understood. But if there are questions, I think they can personally maybe hand the question, send the question to you, and you can meet me, then I will give more clarification on that.
Okay, okay, sir. Thank you very much, sir. At this juncture, I would want to welcome the president, our president, to say a word or two. Dr. Erebo, you have the floor, Madam President.
Thank you. Thank you very much. Thank you, our trainer, consultant, Dr. Bashiru. We appreciate your presence. Thank you for the elaborate lecture. We were sure that you were going to take this topic and actually make us understand what it is to get into the research methodology. Although we know it's broad, although we know that there's a lot to it, but we looked far and wide, and we knew that you were the best person to introduce this topic to the ARD FMC Abuja. And also, we know that as it goes by, it's going to be a series, and we would also like to ensure that you one of these days also come around, either physically or also by the Zoom platform to discuss other topics. And just like our other trainers, will engage them as well. So thank you very much, sir, for indulging us and your presence. We know you are very busy. I know today is your surgery day, but thank you so much for coming to our first lecture series on research, introduction to research methodology. Thank you everyone for attending. This is just the first lecture series on research methodology. We're still going to be having lots of lectures on this as it goes by, and we'll see how we can make it work. Thank you, Dr. Awuzie, to the ESCOs executives, and to everyone. So we look forward to having you all again some other time, and same platform, hopefully, or other engagements like physical or still Zoom. Thank you very much, and God bless you.
Thank you.
Thank you, everyone. And for a lot of us requested for the slides, I will share it in the different platforms where the invitation went to. So I will share it as soon as I get the slides from our chief. Thank you very much.